to this computer. Okay. Hi, everyone. Hope that you're having a great day. This is After Hours with Dr. J. This is a service of Rejuvenate Family Healthcare for our community to get down to business and to the nitty-gritty with the questions that you have about your health. Well, one of the things we need to consider is our mental health. And May is Mental Health Awareness Month, and it's also Maternal Mental Health Awareness Month. And we have a special guest with us this evening. We have Miss Ashlee Reed. I'm going to let her introduce herself.
Okay. Hello, everyone. And thank you so much, Dr. Evans, for allowing me to be on your show and to celebrate Maternal Health Awareness Month and Mental Health Awareness Month. And like she said, my name is Ashlee Reed, and I'm originally from Virginia, but I live in Georgia now. And I'm the owner of a counseling company called Packlight Counseling, and we serve individuals, families, and couples from ages 4 and up. And we take insurance and Medicaid, and we help people with a variety of life stressors like divorce or trauma or anxiety or depression. Um, and so, really, almost anything that you can go to counseling for, we probably have somebody on our team that can help you with it.
And I understand that you start as early as age 4 with
Right.
counseling and
Mhm.
things. That's awesome.
Yes.
Is that with like play therapy or?
Right, yes,
Okay.
yes, we do play therapy. Under age 4, like for your 2 and 3-year-olds, it's even a different style of play therapy. We haven't quite specialized in that yet, but yeah, we can do 4 and up pretty easily.
Awesome. Awesome. Well, that is an awesome thing to know.
Yes,
And
uh-huh.
like we said as we came on, that mental health is something that we need to pay attention to.
Yes.
A lot of times it takes the back burner for high blood
Mhm,
pressure. It takes the back burner for our blood sugar and things when we're talking with our physician or our practitioner.
mhm.
And we kind of say, okay, I'm going to be okay. I'll get through it. I'll be
Right,
fine, you know. Or we don't feel like we're going to get through it. We don't feel like we're going to be fine. And
right,
we don't talk about it with anyone.
right, yeah.
What's your take on what we need to do for mental health in the US and in Georgia to move it forward? Let's start with that.
Okay. Yeah, that's a loaded question because there's so many different things that can be done. I can start with just like an individual level and then up to what can our government and like our communities be doing a little bit better.
Okay.
So, on an individual level, I have a lot of clients that come in and they're telling me all the things that have happened to them in their life or their current stressors. And because I have a lot of people that have like at least some Christian background, they'll quote, "Well, God will never give you more than you can bear," which is actually not in the Bible.
Hmm.
There's the
Hmm.
verse is God will not tempt you beyond what you are able to handle. And so a lot of people are just taking all this stuff on thinking, well, God says I can handle it, so I must be able to handle it. So I'm going to be fine, like you
Right,
said.
right, right.
But he said he wouldn't tempt you beyond what you could like handle. So it's a very different situation. So acknowledging that all this pressure was not meant for you to carry it alone. And actually, I think that's why we're seeing this rise in mental health is because people are more isolated. And, you aren't being vulnerable with people because you feel like you don't have anybody to be vulnerable with that won't spread your business or that'll give you really sound help. And so hopefully finding a therapist that can be a safe space for you to help you process through some of these things and not just talk about it. Like therapists can do a lot more than just talking to you or giving you advice. Um, it's a lot of different things to help you process your trauma from the past that can help you react differently to things in the present. So just changing that mindset on an individual level, I think is really helpful. And then on a government and community level, I really think we've got to do better with our crisis care.
Right.
Um, so many clients are like traumatized by going to the hospital because they just feel like they're being like locked away, and I'm not even talking about like long-term hospitalization, just like 3 days or 7 days.
Mhm.
But we just really don't have a lot of good alternatives to hospitalization. And even once you're there, a lot of times you're not getting the best care.
Mhm.
Um, but I do think it might look like a lot of the things that you have to pay for nowadays, like a retreat. Like
Mhm.
I can guarantee you that somebody's mental health is gonna be a whole lot better after a week-long retreat than a week long in the hospital. Like,
Right,
you know,
right. I
and
got you.
people just don't have the funds for something like that.
Right,
Insurance isn't covering it. So, if we could rework how we respond in crisis situations, I do think that would be really helpful, like not putting people in handcuffs.
right,
Um
right.
and things like that that are just so traumatizing.
Right. And I think sometimes, people aren't sure what's going to happen if I call for help,
Right.
whether I call the local counseling, warm line or hotline, or
Mhm.
if I actually call out for emergency services. Like they're
Right.
not sure what's going to happen with them.
Right.
So
Yeah.
um, they tend to endure what's going on in
Mhm.
harmful ways. you
Right.
Harmful for their mind, harmful for their body, harmful for the people around them, so to speak.
Right.
Yeah.
Exactly. Mm.
Okay. So when it comes to mental health and the family, um,
Mhm.
what we'll say maybe about 2 or 3 tips do you usually tell your clients or just people in general?
Yeah, well, one big thing is to try to actually listen and believe your family members. There's a lot of sort of shaming or downplaying what somebody is telling you. If somebody tells you about something very traumatic that happened to them, or, say they're um, saying that a family member did something to them,
Mhm.
a lot of times that gets pushed down, like, stop talking, don't talk about that, things like that don't happen in our family, and so it's swept under the rug. And so then years later, if something bad happens to that person, you're like, "Oh, we didn't see that coming." But they've been suppressing all of this mental turmoil and anguish for years.
Mhm.
And so trying to actually believe your family member and say, "Oh my gosh, like I had no idea that was going on. How can we separate you from that family member? And how can we get you some help?"
Mhm.
Because I see that happening a lot, sort of this forced communication
Right, right.
before things have really been dealt with or healed.
Mhm. Mhm.
And so, that just causes a lot more anguish.
I understand. Yeah. So we with our family members should be I guess you say not afraid to say I'm having this issue with this person, if you're talking to somebody else that's trusted, I'm not having
Right,
I'm having this issue with this person, or I'm having this issue within myself with my mental health and things like that.
right.
And that trusted family member that you can talk to. And then if your family member comes to you with, hey, I'm not feeling like myself. Something is not quite right. Something is affecting me. What do we do with that information if the family member comes to us with that?
Yeah, yeah. So you could go on Psychology Today and type in your zip code and find a counselor that can help you work through those issues. Or depending on the community you live in, you can go to your local, um, like if you have a mental health services board in your community that has counseling. Um, I know some people start with like a pastor or a life coach because maybe the term counselor or therapist just feels too uh, foreign or just uncomfortable. So, you could start with like a pastor or life coach or something like that and see if they can just help in that initial conversation to then say, "Hey, I think you need to be referred to like a specialist or like a counselor officially." You know?
Oh yeah, and I think that's a good thing about our community resources that we
Mhm.
have contact with on a consistent basis. Even like you said,
Right.
starting there, and they say, hey, I'm glad we had this chat, and here are these resources of people I know or counselors in the
Right.
area that can take it a little bit further.
Mhm. Mhm.
So I think that is a good idea. That is a good thing to have. Um,
Right. Yeah.
and I'm glad you mentioned the like Psychology Today and the local resource areas and things. That way, if you have a family member that has an issue that comes to you with an issue, then definitely then you have something in your toolbox to say, hey, let's talk to these our minister, let's talk to um our physician, and
Right.
let's find out where do we go from there kind of thing. So I guess that's a good anchor or a good starting point. I'll say starting point
Mhm.
if you're trying to help a family member or even help yourself. Um,
Right.
those
Right.
are some good starting points and things. I was going to ask you also when it comes to um, family members who aren't quite reaching out for those services yet or who have not come to you.
Mhm.
Where do we
Right.
start there when we see like, okay, there is an issue here?
Right.
Um, where do we start with that conversation with the family or friend? Where do we start?
Right. Right. Yeah. Well, there's a few levels within that. If you're seeing your family member having like very erratic behavior and they aren't willing to acknowledge it, but it's sort of like manic behavior,
Mhm,
that usually needs some sort of like medical intervention. But if you're noticing more so like they're not showing up for family gatherings, like, they're more isolated, like, you're thinking maybe they're becoming depressed, or you're noticing they're more anxious or something. I would start with, like, just calling ahead and seeing if you can come over and visit, like, bringing a meal by, like, that sort of, like, neighborly checking in doesn't seem to happen as much nowadays.
mhm,
And honestly, that can go a long way in just seeing how somebody is truly doing, because maybe they just lost a job or, finances are really tight. That's really tough for a lot of people right now.
right,
Or maybe they had a surgery and nobody's checked in on them, you
mhm,
know? So it's not always clinical depression, it
mhm,
could just be life stressors, and they're just sort of withdrawing right now. So you checking in, bringing a meal, watching a show with them, like, and maybe doing it repeatedly, like once a week or something, that can really go a long way to just sort of bring them out of like the funk that they might be in at the moment.
right. Well, yeah, those are some good tips. I'm gonna make sure that we have those kind of written out.
Yeah.
But that is good, considering your family members, considering your
Mhm.
we'll call them your neighbors, not necessarily
Right.
neighbor next door, but just people that are
Mhm.
in your realm that may be having something going on. But definitely
Right.
our friends and families, um, making sure that they are there. Um,
Right.
and we are there to help them and things like that. Um, the other thing is, how do you, if it's you yourself that's having issues, how do you reach out?
Yeah, yeah. That's a great question. I think you tend to see a lot of people, like, reach out in sort of a non-direct way on social media, sorta like,
Yes.
um, "My car broke down, my mom just passed, I'm just really going through it."
Hmm.
So it's like that person is reaching out, you know? I
Yes.
think that's what we tend to do a lot of the time is some sort of non-direct reach out like that,
Hmm. Uh-huh.
hoping that somebody will check in on us.
Right,
Uh,
right.
so, I'm not gonna shoot that down. If that's the main technique you have at the moment, yeah, using social media but also being direct,
Hmm. Hmm.
just saying like, "Hey," if you're using social media or you're just texting friends or something, saying, "Hey, I am really going through it. I could really use a phone call or some words of encouragement, or if somebody could stop by with some dinner, or if I could go out to dinner with somebody, like, it would just mean a lot right now."
I
I
got
know that level of vulnerability is really tough for people,
you. Hmm. Hmm.
but you'll be surprised who's willing to step in because somebody else needs that as much as you do.
Right. And I think even within ourselves that is a quote unquote a practice, something that we have to strive to do and something that we have to get better at and improve in
Yeah,
doing is
yeah,
reaching out for
right,
assistance.
exactly.
Um and taking that quote unquote cape off.
Right,
You
yes,
know,
exactly.
um, we don't always have all the answers. We
Right,
uh, all could use some assistance, some support
right,
of some type.
yes.
And in
Mhm.
talking about that, I want to talk about maternal mental health because,
Yeah.
moms are considered the heroes, the ladies
Mhm.
with the capes. The
Right,
get
yes.
it all done and do it all in a
Uh-huh.
snap, so to speak. But in reality, like we've talked about, that's not the case. It's not
Right.
true.
Yeah.
Um, I think introducing some people to maternal mental health will be great
Mhm.
at this point. So just tell us exactly when we're talking about maternal mental health, what are we talking about?
Yeah, yeah, so we're talking about a pretty wide time span. I think a lot of people focus on maternal mental health as like the 6 weeks after you have a baby, like that postpartum period initially, but it's really like a much wider span of perinatal, where that can include any time frame in the woman trying to become pregnant or being pregnant, and then really up to 1 to 2 years after giving birth is that perinatal time frame. But even with just maternal mental health in general, that's such a wide span because can include issues with, like, infertility, and so a woman might not be pregnant, but is still having mental health concerns regarding pregnancy in that mindset. Or, balancing life with children and, your hormones fluctuating in those months after pregnancy, your body fluctuating, having so many concerns with like blood pressure or your pelvic health, or there's just so many things affected by pregnancy or being a mom. And so it's really a wide range of women that fall in that category um, of having maternal mental health concerns.
Yes. We heard the term for so long, postpartum depression, postpartum
Mm.
blues, but we've learned that it's more than just that time frame.
Right, right,
Um, and you mentioned it before, we've kind of lost that sense of community
right.
where people can reach out and help
Yes.
and support. And that goes for, gosh, I'm thinking about people in my life who have children, whether they've adopted children, whether they're having
Mm.
trouble having children, whether they have one child, whether they're getting used to two children, whether,
Right.
whether they have a full family, type of
Mhm,
thing, whatever it is that looks like for them. But
mhm.
everybody has some support that they need. Uh,
Right.
but then, like we said, there's sometimes the clinical aspect that occurs. And
Mhm,
even in adoptive parents, there's a clinical aspect that it can occur after adoption and things like
mhm,
that. How do we, I think it's kind of similar to when we're just talking about mental health in general, but how
mhm,
do we approach a mom or a dad? Because
mhm.
fathers have um problems as well. They have issues as
Right,
well that can occur and is documented and researched that they can
right,
um we'll say peripartum anxiety and depression type of thing
right.
as well.
Mhm,
But how on that span of things that can occur
mm.
as part of maternal mental health, um how do we tell that, okay, this is something you need to go and sit down with your doctor and talk about, or maybe this is
Right,
something that you and a doula
right,
could
yes.
go and chat about with your
Mhm,
counselor. They can offer you some support, um,
right.
or a quick phone call with your best friend.
Right,
How do
yeah.
we kind of like separate out those type of things?
Yeah, so I think the length of time that it's happening, like, if you're noticing I know for people to tell the difference between, like, the baby blues and then postpartum depression, it's usually the duration of time. You know, baby blues being, like, I think those first 2 weeks after giving birth, and then postpartum depression continuing on often for weeks or months, the duration. And the severity, like, how much is this affecting your ability to function? You know? Um, like with something like postpartum depression, are you having trouble maintaining the baby's needs, as well as your own needs? Now, granted, just having taking care of a baby, you're going to struggle to, like, shower on a daily
Mhm.
basis or eat 3 meals a day or get 8 hours of sleep, like, these things are sort of going out the window. But, but if you're noticing that, like, you really aren't getting back into the swing of things. Maybe first reaching out to like your doctor on some of those visits or even your child's pediatrician, because I know a lot of times you don't see your doctor after those 6 weeks. But saying something to your child's pediatrician or a postpartum doula and seeing if they say, "Hey, this has been going on for like 3 or 4 or 5 months. Let's think about counseling," especially if there's been like a traumatic birth or, trouble with the your partner, um, big environmental changes, like if you've had to move quite a few times, or if you just aren't healing properly and that's causing a lot of like mental anguish. If there's been an event, sometimes that can lead to more postpartum depression.
Right, right. Um, I think that is I think we just scratched the surface when it comes to like mental health. Like we could talk about this on and on and on and on. That's why we have experts like you. Uh, the good thing about my practice with Rejuvenate Family Healthcare, I'm
Mhm.
able to sit down with the patient for an extended amount of time and start to work through what's going to be the best course of action at each point that I see them to help them with their mental health. Um, and, I know a lot of physicians who wish they had that time
Right.
with their patients so they could, say, hey, I'm noticing this. Um,
Mhm.
let's connect you with these resources. But the good thing is that they can do some quick, brief things, questionnaires and screenings and things that they can say, hey, um, I want you to go and see this person or talk to this person or this nurse or uh, here is a mental health resource to get you started down the right path to taking care
Right.
of your mental health and your mental wellness. Um,
Mhm.
and that's your child, like you said, even your child's pediatrician
Right. Yeah.
can do that. The good thing is some OB docs are starting to do some check-ins with you as far as like your
Mhm.
mood and things like that 2 weeks or so after you and your well, at least after you arrive home.
Right.
Um, especially if there's been some traumas and things like that, you want to take advantage of that. Um,
Absolutely.
if your provider offers that. Um,
Mhm.
but just know that there are mental health professionals around and out there that can assist with your care as part of the whole postpartum and uh, portion when the baby comes, or even prior to, like you said, like with fertility issues,
Right.
during a pregnancy, think anything,
Right. Yes. Uh-huh.
anything that's a stressor that's causing issue. There are mental health professionals that can assist, um,
Right.
whether it's related to maternal health or just our mental health through every season in our lives.
Mhm. Mhm.
Um, but yeah, I think that that definitely is something we need to make sure that we handle and take care of. Uh,
Right.
yeah. Is there anything else you wanted to add?
I don't think so. No, I think we covered pretty much everything I could think of.
Okay, okay. Well, definitely, Miss Ashley, could you give us your information and I'll make sure that it is
Sure.
below as well. So if someone wants to reach out to you and discuss seeing you for their mental health.
Yes, yes. So, we are on our website is packlightcounselingllc.com, and we're on Facebook and Instagram at Packlight Counseling, and you can find our number on our website and just reach out and we will have somebody get back to you and schedule an appointment. And we do virtual counseling, and we are starting in person counseling in Macon, Georgia in August.
Awesome.
And so we are just looking forward to meeting you and trying to help you.
Thank you. Thank you. Now that virtual thing is definitely helpful.
Yes,
Especially if
yes,
you are busy. It's
right.
definitely helpful.
Yes, no commute. Yeah.
No, yeah, right.
So, yeah,
Well, thank you, Miss Ashley Reed, for joining us this evening, for joining us today.
absolutely.
If anyone has any questions, feel free to let us know at Rejuvenate Family Health.
Mhm.
You can call us 478-309-5500. We're on Facebook, Rejuvenate Family Healthcare, and we're also on Instagram, Rejuvenate FHC _GA. Um, and I hope that we hear from you soon and we can take care of your needs. And I hope you have a good rest of your day. Bye bye.